Ottawa.
So thank you for joining us for this technical briefing on the novel coronavirus COVID-19. Merci de vous joindre à nous pour cette séance de briefage au sujet du nouveau coronavirus COVID-19. Joining us today are Mayor Watson, Councillor Keith Eglai, Chair of the Ottawa Board of Health, Dr. Vera Etches, Chief Medical Officer of Health, Steve Kanalakis, City Manager, and Anthony DiMonte, General Manager, Emergency and Protective Services. Le maire Watson est accompagné du conseiller Keith Eglai, président du Conseil de santé d'Ottawa, de la Dr. Vera Etches, médecin en chef en santé publique, de Steve Kanalakis, directeur municipal, et Anthony DiMonte, directeur général des services de protection et d'urgence. Before we get started, I just want to remind those who are calling in to place your phone on mute until we invite you to ask your question. After the panel's update, we'll take questions from councillors who are in the room, on the phone, or who have sent emails by order of ward. After that, members of the media in the room and calling in will be allowed to ask questions. Par la suite, les conseillers pourront poser des questions suivies des médias. For councillors, if you're having technical difficulties, please reach out to Melody Dauphinet as per the notice you've received. Mr. Mayor.
Great, merci. Thank you very much, and good afternoon, everyone. Bon après-midi, tout le monde. As you're aware, the situation of COVID-19 is fluid and evolving rapidly. I want to thank all of our city teams for helping us manage these events as items evolve. And thank you all for being here today, my colleagues from council, and members of the media, and staff. Thank you to Keith Eglai for his leadership as Chair of the Board of Health, Dr. Vera Etches, our Chief Medical Officer of Health, Steve Kanalakis, City Manager, and Anthony DiMonte, General Manager of Emergency and Protective Services. Thank you all for joining us today. It's important to remind everyone today to remain calm and follow the advice of Ottawa Public Health and the Province of Ontario. We continue to rely on their professional advice and guidance. Je demande à tous nos résidents de rester calmes et de continuer à suivre les conseils de santé publique Ottawa et de la province de l'Ontario. OPH, OttawaPublicHealth.ca, is the best source of information related to COVID-19. So I'd encourage members of the media to continue to use that as the first point of contact, OttawaPublicHealth.ca. As you know, the city has entered into activated operations, which means that all city departments are engaged in the response to COVID-19, and the Emergency Operations Center has been activated to support these efforts and monitor evolving situations in real time. And let me assure you that we're doing everything we can to help protect our residents. La Ville prend toutes les mesures pour protéger nos résidents. And have opened Ottawa's first COVID-19 assessment center in partnership with the Ottawa Hospital and CHEO. The center, located at Brewer Arena, is being used exclusively for the purpose of COVID-19 assessments and testing. All programming and activities that take place in Brewer Arena are currently being suspended to ensure that there's no cross-contact between facility users and those who require assessment. In order to prevent the spread of COVID-19 in the context of mass gatherings, we have also made the decision to close all city facilities where residents gather in large number effective Monday, March 16th. These include pools, arenas, library branches, and cultural and recreation centers, including Meriden Point and Schenkman Center, as well as public events at City Hall. This decision also applies to third-party event organizers who have previously scheduled these spaces for their activities, and refunds will be made available. These closures will be in effect for the next 3 weeks in order to prevent the spread of the virus, so until April 5th, and we will be reassessing the situation closer to that date. That said, at the same time, the city's client service centers will remain open to continue to serve our residents throughout the city. City-run daycare centers are also implementing further screening measures of all children entering the premises, similar to the measures that have been put in place at long-term care homes. With respect to the continuity of government, I've accepted the recommendation of the city clerk, and in cooperation with committee chairs, we will be limiting the number of non-essential committee meetings that take place at this time, as well as to the extent of the items that can be brought forward should meetings need to go ahead. To this effect, I've asked the city manager to work with his senior leadership team to limit the reports coming forward to committees to those that are statutorily required for the time being. This also means that we will postpone all non-essential public consultation sessions. We're also conscious of the impact that COVID-19 is having on our special events community, as well as on restaurants and small business and the tourism economy across the city. To this effect, we've established a task force led by Events Central that will help support festivals and special events in the coming days and months as they prepare for festival season. The task force will ensure that the city provides ongoing and up-to-date information to organizers, and that we keep them properly, and that we help them properly assess the risk associated with their event, and to better understand the mitigation measures and options that are available to them to protect their participants and their volunteers. We'll also be holding a meeting on Monday, this Monday, of BIAs, le Regroupement des Gens d'Affaires, the Ottawa Board of Trade, and Ottawa Tourism, to update them on these plans and see how the city can support them through these very challenging times, particularly the small and medium-sized businesses. I want to take this opportunity to thank our team at Ottawa Public Health, led by Dr. Etches, for their leadership during this very challenging time for not just the city, but in fact the world. I also want to thank our medical partners at the Ottawa Hospital, CHEO, Queensway Carleton, L'Hôpital Montfort, as well as all the healthcare professionals across the city for their hard work and continued support in this evolving situation. Un gros merci à tous nos professionnels de la santé au cours des derniers jours et certainement au cours des semaines à venir. Again, I want to reiterate that we are all working together to help prevent the spread of COVID-19, and I'll ask Councillor Eglai, the Chair of the Ottawa Public Health Board, to say a few words, who will then hand it over to Dr. Etches.
Thank you very much, Mr. Mayor. I just want to take this opportunity to say that over the last few days, last few weeks, I've seen very up close and personal the hard work that public health has put into this, and I think we're in good hands. There's been a lot of hard preparation work put into this, a lot of good partnership with the Ottawa Hospital, with the province. We saw the fruits of that this morning with the opening of the Brewer location, and that's a partnership with the greater city as well, led by our city manager, Steve Kanalakis. That's how we're going to get through this. We're going to work together. We're going to be positive, proactive partnerships. And I think we have a good foundation for that right now going forward. And again, I want to take this opportunity to publicly thank Dr. Etches and her whole team, and Steve Kanalakis and his team. The level of cooperation has been immense. The number of meetings all day, every day, to make sure that the citizens are in the best possible place they can as we deal with these very challenging times. So I'm now going to turn over to Dr. Etches to give some more background about what we've done and what services we're offering the residents of our city.
Thank you, merci. The work of Ottawa Public Health continues to be to try to limit the transmission of this virus in our community. And the way we are focused on doing that is to let people know when they could have come into contact with the virus through travel outside of Canada, to recommend that when people need to seek assessment if they develop respiratory symptoms within the 14 days of returning, and making sure that they have the ability to have that assessment and the swabbing done, and that we can follow up on any positive cases, making sure we identify the contacts around that case who are close contacts who need to then also self-isolate and monitor for symptoms within the next 14 days. So we've been going through that process. Before our first confirmed cases in Ottawa, there's a lot of people who presented for testing, so the vast majority of tests to date have all been negative. Today we saw the mechanism we're using to share information about new cases is on our website on a daily basis. We do have a third case now in Ottawa. This was a woman in her 40s with recent travel to the UK. She's currently in self-isolation at home with mild symptoms, and we're still continuing the contact follow-up with that case. As usual, we start with the household contacts and those who are in close contact, and we move out from there. The other work that public health is doing is to answer inquiries that come from councillors, that come from residents and from healthcare providers. And certainly our phone line is very busy. We still continue to see wait times because the call volume still continues to double day over day. We went from 200 to 800 to 1,600 calls yesterday. Therefore, we are broadening our team. We continue every day to broaden our team. We have up to 80 stations now to take calls, and and we're drawing on non-nursing staff through 311 and others to continue to try to catch up, make sure that those who have left voicemails are addressed, and then we can continue to meet the demand. That call line is open 7 in the morning until 10 at night. When I mentioned that we have a role in making sure people can access testing, that is for those who meet the criteria. So we've spoken a bit recently about having a new assessment center that opened today at 12 o'clock. Apparently, in those 2 hours that I have an update from, about 200 people have been seen. Only 12 required testing. And so I think you see the challenge we have here, and it's the same on the phone lines. Not everyone needs to be assessed and tested, and so really trying to drive people to our website, to use the website to assess whether I need to be tested. There's a algorithm people can walk through. Other sources of information, online support, people could access our Telehealth Ontario. But really appreciate if you can make that point, that people generally in the community who have respiratory symptoms will not be tested unless they have a travel history outside of Canada, where you're much more likely to encounter the virus, or if they've been in close contact with a confirmed case here in Ottawa. There was mention, I think, on Twitter, as many things are mentioned on Twitter, that the Queensway Carleton Hospital opened a drive-through assessment site. In fact, that's not sort of like open for the public, and that has been scaled back. It was to handle just the demand and the capacity that they were facing at that time last night. It enabled them to handle the people who had been referred to the Queensway Carleton specifically. And now the main message is all testing that is for people with mild symptoms, we want them to go to the assessment center, the Brewer Arena. And that is children. CHEO is leading work to make sure children can be assessed appropriately, as well as adults. If people have severe symptoms, they fall into that category of travel or a close contact, or short of breath, they have chest pain, more difficulty, then that is what we're saving the Emerge for, those situations where people need to go to Emerge. I think the other update from today that is important to share more about is that the province has given us some guidance around large gatherings. I'm just going to actually directly quote from the Chief Medical Officer of Health, who said to avoid all non-essential travel outside of Canada. That's a strong advice, is the way he's phrased that. He's also requesting colleges and universities to immediately look at virtual options to provide services, and we know that that is underway in our community. And the mayor mentioned childcare settings. Some of the city runs some childcare settings, but all childcare settings are meant to actively screen children, parents, staff, and visitors for any symptoms of illness or travel history that could have put people at greater risk of encountering the virus. So that's information we're sharing with private childcare providers as well. And then the Chief Medical Officer of Health says that he is recommending the immediate suspension of all large events and public gatherings of over 250 people. And so this is what, I think the mayor spoke to is behind some of the closures and, that we'd be looking at as a city. So the mayor also mentioned, event organizers need some support around this and some help around understanding what applies to them, especially if they're under 250, then what do I do? And so we are going to increase the material on our website for people seeking guidance about canceling events under the 250. The guidance from the federal government still applies in terms of taking a risk-based approach. So if it is with people who are traveling from around the world, that's probably the kind of event you want to just cancel. And if it's people who are more vulnerable that are gathering, again, we can take measures to just limit the number of people. That helps. Limit the kinds of contact people have at events. That helps. Those kind of guidelines are available as well, and we'll help people through them. think I want to also point out, because we're getting a lot of questions from workplaces, that we have some material specifically for employers and workplaces on our website. It includes a general sick note for individuals who need to self-isolate at home. So people can access that themselves, they can print it out. It's a record, it demonstrates why people may need to self-isolate. So the city, I think, may speak a bit more about some of the other work underway in the emergency control group. We are getting questions about shelters and support for people. I think if that's not addressed, I can come back to it. I think I will conclude with the other update from this morning. Oui, en français, après je peux dire le point plus important. The other update from the Chief Medical Officer of Health this morning is clear direction. It is a directive, the first that he's issued in this response, that the transmission of this virus is by droplet and contact. So that means what we've been saying all along is what the science is telling us to date, that this is a virus that has a heaviness to it, that does not float in the air. I'm going to contrast that with measles. If we had a case of measles in this room, we would all be considered close contacts. And we would have to consider anyone who came into this room for 2 hours afterwards a contact of someone with a case of measles. In contrast, oh dear, now this is going to, but it would just be with a droplet, it's just you two. I'm well, thanks. That would be close contacts. So in this room, none of you would be close contacts of a case unless you had touched something that I had touched if I was infected. So I think that's really important, that it reinforces what we've been saying about the transmission, and the implication is for healthcare settings that, and you'll see it in the assessment center, that people providing routine care do not need to wear a fit-tested N95 mask. They are able to provide routine precautions for droplet and contact spread. We do know that in hospital settings, there are some times when people need to be intubated or more invasive procedures, and in those cases, that's when we would reserve the use of N95 masks for airborne precautions. Alors, en français, il y a différentes directions, nouvelles directions qui viennent de le chef de médecin en santé publique pour la province. Il a dit que la transmission de ce virus est par gouttelette et par contact. Aussi, il a fait une recommandation d'arrêter avec les événements où il y a 250 personnes ou plus. Aussi, il veut que les universités et les collèges examinent les options d'avoir les classes virtuelles. Et aussi, il a mentionné que c'est important pour les centres de soins pour les enfants d'avoir un processus pour vérifier que les enfants et les travailleurs, les parents, les visiteurs sont en santé.
On va
Ah oui, OK. Depuis l'ouverture de la centre d'assessment COVID-19, dans 2 heures, nous avons 200 visiteurs et seulement 12 dépistages. Parce que ce n'est pas tout le monde qui se présente qui a besoin d'un dépistage. C'est la population à risque, exposée dans une situation de le virus comme hors Canada, à l'extérieur du Canada ou un contact d'un cas confirmé. Alors, je peux passer à mon...
Thank you, Dr. Etches. And I want to thank Dr. Etches and Chair Keith Egley for the outstanding collaboration we've had up to this date to integrate our Emergency Operations Center and the knowledge and expertise that we have in the city. And the staff at Public Health are outstanding, and we appreciate the support we've received from both of them, so thank you very much. The approach we're outlining today is really intended to be preventative and precautionary. The situation has been evolving rapidly. The last 24 hours has been a situation in my 36-year career that I haven't seen evolve so quickly in terms of the escalation of the efforts the city is making and various organizations across the country are taking. With that, I ask for some patience because sometimes the messaging doesn't always keep pace with the events, and we ask for your patience as this situation rapidly evolves over the next period of time. As Dr. Etches said, we have 3 confirmed cases of COVID-19 in Ottawa, and each of those cases was contracted as a result of international travel, which is a significant difference in terms of how we expect this to evolve. The changes we're instituting are intended to help us stay ahead of the curve when ultimately we will see transmission between people who haven't traveled. And this is to help stop or minimize possible spread within our communities. Mayor Watson has announced a number of measures and closures that our senior leadership team and our Emergency Operations Center has recommended, and we've adopted those today. And this is truly about minimizing the spike in the number and severity of cases. So this is a partnership between our city, this is a partnership with our residents, and we need to work together to help prevent the spread. And I know that the residents are following the advice of OPH and taking preventative measures at home and working in public settings to limit the impact in Ottawa. And we ask you to continue to follow OPH advice as city staff are. As the situation continues to evolve, the city is committed to keeping people informed, but we rely on OPH for that information. That is our main source of guidance in terms of how we deal with our response. After all, the city is a service provider first and foremost, and beyond our responsibility to our residents, we provide essential services to the people of Ottawa that we simply can't curtail. But those services are provided by our employees, and we need to make sure that they remain safe. So yesterday I provided direction to our general managers, followed by communication to all staff in response to this rapidly changing situation, and another communique will be going out today based on the most recent information that we have from the Chief Medical Officer of Health of Ontario. I asked all general managers to examine their workforce to see where there's an opportunity to ask people to work from home. It's not as simplistic as it may sound. We have 105 different business lines, and some work has to be done over the weekend to determine exactly which workers will be encouraged to work from home and be directed to work from home, yet be able to maintain the frontline services that our residents depend on every day, and that, quite frankly, our city depends on to be able to run and for people to function. I also directed general managers to develop business continuity plans to ensure that we have the staff and resources to provide the services that our residents depend on throughout this evolving situation. And a business continuity plan, in simple terms, is ensuring that we have reserve staff available to be able to continue through the most difficult of times. And as Mr. DeMonte is going to tell you in a few minutes, we've also moved into enhanced operations for potential flood operations coming up. If you remember this year, or last year on April 4th, we moved into enhanced operations for floods, and by the end of the month, we were in full operations. We were activated, and so we are planning for both scenarios, and we need to have staff on reserve and healthy to be able to sustain our city services over the long term, and that planning is happening. It started yesterday and is planning over the weekend. I also directed that all business travel by city employees be suspended immediately, and that's been taken effect and announced to our staff. We're also taking steps to help prevent the spread of the virus in our facilities to protect both our workers and the public. First off, if people are showing signs of illness, please do not come to city facilities. We're placing signage at city facilities asking residents who are showing symptoms to leave or not to enter the facility. We are asking people who are planning to visit Service Ottawa service centers, which will remain open, to look online to see if the services are available on ottawa.ca. Many of the service requests that you need to do are in fact available online. There's no need to come into our client service centers. For example, you can visit ottawa.ca to pay your water bills and your interim property taxes online, which are coming due this month, the first installment. Likewise, if you're ill and have a court date at the Provincial Court of Offences at Mary Pitt Centre on Constellation Drive, you can call 311 and they will help you reschedule your court date, and we've confirmed that with the Provincial Courthouse Administration. These actions are being taken to protect the public and our employees. The health and well-being of our people and our community are a priority. And now I'll pass it on to Anthony DeMonte, who'll talk about our emergency management posture that we've entered into. Thank you.
Thank you, Mr. Kanellakis. So the City of Ottawa's Emergency Operations Centre remains in activated operations in response to the novel coronavirus. This means that all the senior leaders and every department are meeting regularly and actively to develop and implement plans in response to this global event. And as you've heard from Dr. Etches and others, it's an evolving situation that we have to continually upgrade. Le Centre des opérations d'urgence de la Ville d'Ottawa demeure en mode alerte face au nouveau coronavirus, ce qui signifie que les cadres et le personnel se rencontrent régulièrement afin d'élaborer et de mettre en œuvre les plans face à cette situation qui touche le monde entier. The City of Ottawa, in collaboration with Ottawa Public Health, local, provincial, and federal partners, have been planning and preparing for this possibility of a pandemic situation for some time. All city departments, as well as Ottawa Police Service and Ottawa Public Health, are engaged actively in this event as it continues to evolve. Nous concentrons nos efforts sur le soutien aux résidents d'Ottawa, notamment les plus vulnérables d'entre eux. La Ville, en collaboration avec la santé publique d'Ottawa et les partenaires locaux, provinciaux et fédéraux, se prépare à la possibilité d'une pandémie depuis quelque temps. Tous les services de la Ville, ainsi que le service de police d'Ottawa et santé publique, y prennent part activement alors que la situation continue à évoluer au niveau mondial. This could be a long-term event. Our focus is on supporting Ottawa residents, especially our vulnerable residents, and continue to provide essential service as well as maintaining the health and safety of our workforce is a top priority. As Mr. Kanellakis indicated, we have our regular operations which we have to maintain. We have this new challenge in front of us, and I will be talking in a moment. We've entered enhanced operations to prepare for spring flooding. We continue to make all our decisions and take advice and actions based on professional advice from Dr. Etches and her dedicated team, and we echo the message on the coronavirus to the public to stop, to work together to stop this spread. And all our actions are based on science and are directed towards stopping this spread. As well, our Emergency Operations Center has a separate group that is now mobilized in enhanced operations for the 2020 spring flood possibility. This is a precautionary measure given the previous flooding of events along the Ottawa River. Moving into enhanced operations now heightens our ongoing coordination between city departments to ensure preparedness. On that front, the city already has 250,000 sandbags filled and ready to deploy, with an additional 387,000 sandbags in reserve. And while it seems odd, it gives you an understanding of the complexity of what we're dealing with as a city: flood, COVID, and then our day-to-day operations, and how do we maintain this maybe over the long term. So we continue to remain in communications with local, provincial, and federal partners, in addition to the local conservation authorities and planning boards monitoring conditions along the Ottawa River Basin. Moreover, a communications plan for residents has been implemented and developed and will be implemented over time in response to real-time developments and the weather conditions in the coming weeks. We remind the public to stay home if you are sick. Please do not visit our long-term care facilities and city facilities if you are displaying symptoms associated with COVID-19, including fever and/or a worsening cough. And while the risk to Canadians for the community and their community remains low, it is important for us to be prepared to respond to this event as it continues to unfold, and our team is focused on that with the support and expert opinion of Dr. Etches and her team. Merci beaucoup. Thank you.
Thank you, Mr. DeMonte. We will now take questions from councillors per order of ward, please. So, Councillor Luloff.
Thank you very much, everybody, and thank you for the work that you're doing on this incredibly important topic. In my ward, we have the Orleans Cumberland Resource Center, who provide vital services to populations at risk. There is a network of resource centers throughout the city. What role actions are you recommending that they take today?
You're right. The resource centers across Ottawa are an essential support in our communities. We recommend that they follow the guidance of the Chief Medical Officer of Health to look at if they're planning any events that would bring together more than 250 people to revisit those events and make an alternative. As well, the precautions we're instituting in city facilities are relevant in terms of making sure that when people are coming in, that we're looking to make sure that they're not ill. If they're ill, that people go home. I think we're going to need every partner to help in our community, and we'll have ongoing communications with the resource centers.
Will early on child and family center programming funded by the City of Ottawa through the province be closed in the next few weeks as well to coincide with the announcement that was made today?
So my understanding, and if you follow the language from the provincial Chief Medical Officer of Health, it is not to close childcare centers. Childcare centers are critical for parents to be able to get to work. It is to make sure that the childcare centers are taking extra precautions to ensure that illness is not introduced into those settings.
Est-ce qu'on a des messages bilingues concernant les impacts sur culture et récréation dans la ville d'Ottawa? Including a complete list of canceled programming and rescheduling and refund options for our residents.
Oui, certainement, la réponse est oui. Nous sommes en processus de notifier tout notre personnel et quand après cette conférence de presse sur notre site de web ottawa.ca, on avait des messages dans les deux langues officielles pour des résidents. Et c'est la même chose avec le site ottawapublichealth.ca.
Santépubliqueottawa.ca/coronavirus.
On working from home, what enhanced support services are being provided to municipal workers to enable easier working from home?
Yes, we are putting guidelines and protocols in place for our employees that are working from home, including equipping them with additional technology that they need to be home. Our IT department is looking at clear instructions, whether they use the VPN, which is the dial-in number, or the people who are on Office 365 that we've installed who can go on and basically virtually do anything. And they're also going to be receiving guidance about the expectations when they're working from home, that they log in the morning, they're available on their cell phone, they log out at night, they keep in contact with their manager and their supervisor. So those protocols are being worked on right now. We hope to have the guidance to our employees by the end of day Tuesday is when we expect to have guidance to them.
Great. What advice would you give today to private organizations like the YMCA or other sports organizations that are considering the information that we're providing?
It's really the same advice. We're looking to cancel those events of 250 or greater, and if you can institute measures that protect transmission of respiratory illness in centers, that's important.
When it comes to on-time decision dates for planning items moving forward, are they still considered statutory requirements, or is there going to be some leeway there?
The clerk is actually working with Mr. Willis to look at all the reports that are coming, because there are some that we are legally obligated to bring, and they're going to be doing a review of every report and the statutory requirement to bring them forward to council and planning committee and schedule those meetings.
Okay, so is this assessment of the key takeaway?
Luloff, I think in fairness, we've got 24 wards, so you've asked about 5 questions. Can we get to Ward 2 and then we'll come back to you for a second round?
I certainly have one more. Is that all right, Mayor?
All right, well,
I'll be pleased to
and
see
maybe
the floor.
for future councillors, just remember we have, I think, half of council here and a number of people on the phone that have questions.
Sure.
Thank you.
Councillor Judas, come on up. Oh, okay. So is this assessment of the key takeaway correct, that measures that are currently being implemented are to reduce the risk of the contamination to the community, meaning that the current risk of contamination is mostly those who are returning from travel outside of Canada and exhibiting symptoms, and those that may have come into contact with also exhibiting symptoms?
Yes, that's what we're seeing in Ottawa to date. We have seen that the cases that are identified are related to travel, and then we're following up to assess whether there's been any transmission around those cases. I have said, I'll continue to say that we don't have confirmation of transmission in the community. What we know is that sometimes by the time you get confirmation, it's started to increase more rapidly. And so you can see the direction from the Chief Medical Officer of Health in the province is protective. It's early direction. It's before we have that evidence of community spread, which is meant to really have an impact early on. There is no question when you look around the world that closing schools and implementing social distancing measures can dramatically slow down a pandemic of this nature and decrease the number of people who are sick all at once. That's really important for the burden on the healthcare system. If we can slow down transmission and bring it down so that not as many people are ill at once, our health system can cope more easily. That's the objective behind this advice.
Merci tout le monde. Bon courage.
Councillor Dudas?
Thank you, Matt. First of all, I want to thank you all so much for the work you're doing, our mayor and leadership and OPH and city staff. Phenomenal job. We all appreciate it. I think the community appreciates it. I only have a couple of questions. I'm sure I'll get on to my colleagues. I wanted to know what was the immediate impacts or if considerations are being given to specific city operations, in particular bus and transit systems, as well as our first responders.
Well, the challenge we have is that many of our employees are frontline employees to deliver essential services. And, you know, I don't like to define things essential, non-essential, because everything contributes to the whole in terms of the service. But bus operations and transit operations are critical services, as we've been hearing recently in various committee meetings and councils. And we are taking the same precautions with those employees in terms of whether they're sick, not to come in, the cleanliness of the facilities, the protocols around wiping down buses and trains. We're reviewing all that as we go forward. Our first responders, we're reviewing all the personal protection equipment, the PPE for all of them, and following the guidance of OPH in terms of their work. We had an incident where it was reported that a firefighter was being tested that had returned, who was in a station. It turns out that test was negative, so that's a positive thing. But the first responders, and Mr. Demonte can clarify more. Chief Slowly, Chief Fayot, Chief Kent were all in the Emergency Operations Center yesterday having those discussions. They all have their own pandemic plan policies for their services. They're implementing all of those in terms of protecting their employees, focusing on critical functions that they're going to deliver, focusing on what to do if someone is sick in the workplace, how do we integrate with OPH, and how do they protect themselves on the calls that they have to go to. So that is a very robust system that we have internally.
Understanding that the situation's evolving constantly, and I'm sure you're going to want to jump in on this, but just to add to that, in terms of our public transit system and the proximity people are in when they're on a bus or a train, is there a consideration being given to enhance communications to people using those systems as well as we go forward?
Well, we discussed that this morning with Dr. Etches, and you get into this situation of what does it mean to have people more than 250 people gathered together on a train, and we suggested the communication that could be is people staggering the times that they go, so we don't have the intense peaks that we've been having in terms of the rush hour periods, trying to spread that out over longer periods of or extended periods of time to smooth that out. We also think that based on the actions that many individual employers, the federal government will be taking, that we're taking, there will be a lessening burden on public transit over the next while. We have a period of at least 3 weeks of extended March break. where a lot of people will be home with their children. So we're expecting that volumes, and we're seeing that actually already, are dropping on the transit system. And quite frankly, I think that's going to help us.
In terms of council and committee meetings, I understand we're moving forward with mandatory and statutory requirements. If this proceeds, and we know it will be, is there a plan in case we have to suspend those meetings? Is there legislative requirements in terms of being in person and present for votes? Does this mean that all decision making would then reside with the executive leadership?
Ask the city clerk to comment. We're not allowed under the Municipal Act to have a teleconference session or voting, so that unfortunately is not at our disposal. What we're trying to do is minimize the length and number of meetings that we have, because obviously this is a public gathering spot, and we want to make sure that those things that are required by legislation or statute are carried out, or if there are time lines that would be affected, that we try to deal with those as well. But I don't know if Mr. Clerk, if you can offer other advice. I know the clerk is going to be issuing later today a note with a series of recommendations that he's put forward.
No, I think that just about covered it, Mr. Mayor. Thank you.
And just to build on that one more time, in terms of statutory requirements for, say, Planning Act items, which Councillor Lulov has asked for, are we going to be implementing, are we considering, are we putting in the technology in case we have to provide those public engagement opportunities in an online format?
Yeah, that's one of the options. We indicated that unless it's essential, public consultations during this next 3-week period will be suspended. If there's a requirement for public consultation due to a provincial law or statute, then obviously we would have to go forward with that. But our goal is to try to minimize large gatherings of this type. And if we had the ability to operate through a teleconference, I think we could still continue on relatively business as usual, but that's not an option available to us, unfortunately. So the clerk's been consulting, because we have, I believe, 2 meetings next week, Police Services Board and Transit Commission, and whether those are necessary to go ahead or if they can be put off. That's what the clerk is working with the Police Services Board and the Transit Commission.
Thank you very much.
Thank you. So now we're Councillor Harder.
Thank you. My first question is whether or not, Dr. Etches, if you've had any news on different protocols that we may be seeing, a different approach at airports, borders, etc., for people that are returning or leaving. Have you heard anything on that?
Yes, thank you, Councillor. We are in regular contact with the Ottawa International Airport, and we understand that they are exploring additional supports on site to have some health staff on site. They don't usually have them right on site. They usually have Canadian Border Services. So I'm not sure of the exact status. I know they are federally looking at different measures to increase approaches at the border, and I can't speak to any federal decisions that are evolving.
But if you hear of any, you'll let us know, correct?
Certainly.
And also, then, are you planning any more centers besides the Brewer Park Centre?
We definitely are thinking about the geography of our city, and if the single center is not able to meet the demand, we have a process to look at other sites east, west, and south, and that is something that is being led by the Ottawa Hospital, and in partnership with CHEO and the other hospitals, we'd be looking at increasing the options across the community. I think with just 12 tests being required so far today, I think the volume is still relatively low, and we'll use that, we'll monitor that to determine if we need to open other places.
Good. I mean, you did say, I think, that 200 people showed up, even though you only did check, I think, the 12. So I just was looking at the OC Transpo trip from from the Walter Baker in Barrhaven to there, an hour and a half. So I just say, I don't know whether you'd want somebody that may have an issue to be on a bus that long.
Yes, I appreciate that, and I do recognize that for residents across the city, it's a very large geography. I think what I would also add to my initial answer is that the options are not just an assessment center. The change in the provincial direction around having to use an N95 mask now recognizing that as a higher level of protection than is needed does open up the ability of family physicians to do some testing in their offices. They don't need to be fit tested. We know there are other innovative models like the drive-through, like paramedics. So I would say all of these things are being explored to provide better access to testing, and I'll continue to provide an update. That is the healthcare sector now that is responsible to make that possible, but we are providing guidance.
And I just wanted to say that on the issue of grocery stores and supply chains, I think that we're seeing an incredibly high rush of people going desperately searching for not just toilet paper, which has been the norm, but certainly for food and that. And I think that probably it's because people have made a decision not to go away on March break, and so they're filling their empty cupboards with product. But have you heard of any concerns about supply chain and getting product here to our stores, or of any of the chains thinking of closing down?
I am not authoritative in this realm in terms of the status of all of the grocery stores in the city. I think, if we were in a truly an emergency situation, that's something we'd have a better handle on. The lineups I hear are large at some grocery stores, and I can appreciate that would cause challenge. I think the advice we've been providing is that you need to have the supplies on hand to be able to care for yourself or your loved ones if you become ill for a period of, 1 to 2 weeks. And that doesn't mean a lot of stockpiling. It means some preparation.
I know, and I think though that I know I certainly would have some contacts that I could find that out. I just want, and as far as the numbers of people that are gathering in these places, that's something that we may, if we can, and we need to, look at trying to manage better and help the leaders of that kind of industry with us. The fire department closed down the Costco in Barrhaven today. So that's a lot more than 200 people that are meeting. Anyway, listen, I think you're doing a great job, and I have lots more questions, but I'm sure others will ask. So thanks very much.
It's Councilor.
Sorry, thank you. Councillor Suds, please.
Sorry, can I just jump in very, very quickly? My phone is about to die. I'm not in a place where I can charge it. I just wanted to say thank you, and I'll be foregoing my Ward 17 spot because my phone will be dead by then. But just thank you to OPH and the public health unit and the Ottawa Hospital. They've been doing a fantastic job within Ward 17 in the Brewer Arena. And I've been very happy with the FAQs that have been presented and continue to update our residents. So thank you very much.
Okay. Thank you. First question, and I know, Dr. Etches, you alluded to with respect to what's happening for workers as well as those that are making use of our shelters. Any protocols or safeguards put in place there?
So I mentioned the advice to employers has been built up on our website over time. Employers have a lot of questions about what they should be doing. I think the large gathering piece makes sense. Think about the all staff meetings that you have. Think about whether your employees can work from home. look at other ways of doing your work virtually. You know, some things are applicable, some things aren't, depending on the type of employment. We know employers also have questions about if there was a case in my workplace, what would I do? That is a process that Ottawa Public Health goes through if there is a workplace involved in a positive case, to identify those who are in close contact and follow up individually with people. If it's unlikely that a workplace would be closed down, but if there are broader measures that are needed, then public health would communicate about that. So I think that's the place to start. And then if people have further questions, they can always consult with us.
Okay. And with respect to our shelters and homeless?
Yeah, just, I don't know, Tony, did you want to speak to the task force? Human needs around shelters.
Yeah, the human needs. Thank you, Councillor. So there's, as part of the emergency operations group, there's several groups that have been set up, several task forces that are focusing on that. So the human needs group will be focusing on those items, and we have others like the supply management group. Councillor Harder was just asking about that. A workforce group as well, too. How do we maintain our workforce if we lose, scenarios, if we lose 20% of our workforce, what do we do? And one that the mayor mentioned as well, too, the gathering and events group, how all the major events, how do we follow the direction from the province with regards to major events, and how do we support them, do their analysis. So all those task force have the expertise around the table and are looking at all those individual elements to be able to respond to them.
Okay. And maybe a step forward, thinking of another vulnerable population being the elderly. And again, any protocols or assistance put in place to make sure that we're checking in with that population?
So again, as part of the emergency operations group, like we do in floods or tornadoes, those different populations are identified. We have specific wards that have high rises with high percentages of patients that are elderly perhaps and are more vulnerable. That's being assessed now and being tracked. A lot of that link will be done with public health because a lot of it is related to that. So if those individuals are in situations where their comorbidities or their issues, certainly they start getting infected and there's challenges there, they'll be tasked. But this is a very different type of emergency than we've really responded to, and it's longitudinal and it'll be much more different. So really public health, by what they're analyzing, is helping us direct and focus our energies. So the answer to you is directly yes, that's important. It's part of our analysis. But right now, we're not seeing that as a major issue, but it's on our radar.
Okay. And maybe on the positive side of what's happening right now, I know I've had a number of residents reach out saying, how can I help? Is there a mechanism for me to volunteer to help those who are isolated or quarantined? Has there been thought to a process around that, being able to engage that volunteerism?
Yeah, and has been our experience, and fortunately in this community, whether it was for flooding or the tornado, volunteer management and the volunteers have played an essential role. We're not there yet. We haven't seen that demand. We obviously have the capacity. It's very much an analysis of what's going on in the community. It's very much a healthcare focus. But if we move towards, things about delivering food to people, that type of thing, volunteer management will be something that'll be essential and will tap in quite quickly. So again, one of the task force in the human needs groups is a supply management team that looks at how we manage volunteers.
Okay. And maybe one last question. I think Dr. Etches has alluded to the fact that we haven't had a local transmission yet. And I think the question there being is, when that happens, and assuming that it is going to happen, how does that change the dialogue that we're having right now?
I think what we have right now is a period of time where we anticipated there's higher risk with people returning from travel, and so the measures we're talking about are for a three-week period to cover the 2 weeks after we know more of the population is traveling. We'll have to revisit whether some of these measures continue longer term based on that kind of scenario.
Okay. Thank you. Thank you very much.
Thank you. Councillor El Chantiri.
question is to Dr. Etch. First of all, thank you all for doing a great job with the communication and the information. For those isolated area, I don't mean isolated, but the one out of the city core or out of the suburban, in a rural area, have you thought about have mobile, whether paramedicine or other public health, those areas, and spend perhaps certain hours in Fitzroy Community Center or Constance Bay or others?
Councillor, it's Anthony DeMonte. So yes, Dr. Vera and her team, we're looking at that. That's something that's being done in some rural communities elsewhere in Ontario. We stand ready to support Dr. Etches. The paramedics have got the clinical capacity to do that, and we'll have a team. And as she and her team, she was talking earlier about the large geography, and they're looking at that. They're seeing what they're going to see now at the assessment center. As that unfolds, it is something that we're ready to put into place, and we will be able to respond to have paramedics doing those assessments in homes at the direction and the coordination of Dr. Etches and the Ottawa Hospital team too. So the simple answer is yes, we have that on the ready, and when we feel it's necessary, or Dr. Etches and the medical team feel it's necessary, we'll implement it.
And my thank you for that. And my second question to you, Mr. DeMonte, you talk about the flood mitigation, and as we all know, it's still early for the flood. Have you thought about, instead of just having 250,000 sandbag ready, maybe we can get some more ready when we still have all the workforce available to us, versus if we wait longer, we're not sure what situation will be in it, or if more people stayed home or something. Have we thought about being more ready than the 250,000 bag at this point?
Yes, Councillor. So that's one of the reasons why we've stood up a completely separate team, and I know you and I have had these discussions. These are lessons learned when we had the flood, and at the same time we had a tornado. We had that all being managed. So we have two separate teams. They're an emergency operation team that is strictly focused on flood mitigation. Over the 250,000 bags, we have an additional 387,000 that are in reserve. The team are already looking, as you're aware of, because you've been directly involved in all of these. Our mobile command posts are already being prepared. The teams are being prepared. And yes, directly to your question, it's something that we're looking at. What happens if we lose a percentage of our staff? How do we augment that to be able to respond? So we're quite acutely aware that while this COVID situation that we're dealing with is extremely important, we have a lot of effort there. We have our regular operations, but we know that we could have a flood response, and we don't want to be caught flat-footed in any way. So we're putting all our energies there, and I can assure you that we'll be ready to respond if we have another unfortunate situation that we've had in previous years.
Thank you so much. Thank you, Mr. Mayor.
Thank you. Councillor Gower?
Thank you. My question is for Dr. Etches. What I'd like to know is, at this point, what can we do as councillors and as elected officials to best support the efforts of Ottawa Public Health?
Thank you for that question. I think what's most important is to let people know to use our website as a primary tool for information, and even working out that assessment process of whether I am personally at risk or needing to have a test completed. We are trying to protect our phone lines for healthcare workers. When healthcare workers call us with a question, there is a priority sequence given to them. We want to make sure that people who need follow-up, if they've been in contact of a case, can get through. So really trying to help with the questions from the worried well would be really helpful. Sharing the information that we have, that's useful.
Thank you very much, Dr. Etches, and thanks to everyone for the information today.
Thank you. Councillor Kavanagh?
Oops. Thank you very much. Et merci pour tout le travail et merci pour la mise à jour. My question is in terms of emergency preparedness. This is something that we're getting used to in Bay Ward, and we actually had another dry run this weekend where we had a power outage. So again, questions came up about being prepared. And one of the things that keeps coming up, and it's already been talked about, is how can I help? And there are community members there that are saying, I want to be there and help. And we had that during the flood, and we learned how to deal with it. But I think we have to be ready again of having some kind of a registry, some way of making use of people who really do want to help, because one of the big factors, especially in an area like mine, is vulnerable people on their own and who have no one to reach out to. So I'd like to know what efforts are being made on that. And as councillors, I'm sure we'll be very happy to help in helping that move along in terms of our own communities. So I'm hoping you can help me out on that.
Councillor, as you know, we have Are You Ready campaign, and we ask people to be ready for 72 hours. And with your leadership in your ward, we've done several community meetings and follow-up. So I think we're well on the way. I think that's the perfect example of how councillors can assist us to enter into some of your communities and your wards. And we're at the ready to send our teams in there to help you and make the communities resilient, individuals resilient for 72 hours. That's just in a general principle. We're not talking about COVID. Is a very different situation. So I would suggest to you and other councillors that the team at the emergency management team is more than willing to continue to do some of those training sessions in each of your wards.
Thank you. I already have a meeting set up, and I had it previously set up already for April 4th on emergency preparedness, getting ready for the spring. And as it turns out, I'm probably going to be doing it on Facebook Live so that we don't have a gathering. So I hope you'll be able to help us out with the sending of staff. But in the meantime, I think we will be taking names down of people who want to help, because people just want to go out there and knock on doors and be sure that others are checked on in the meantime. Thank you.
Thank you, Councillor. Councillor Shirley? Councillor Eglai? Do you have questions?
I'm good, thanks.
Councillor Deans?
Hi, everyone. And I wanted to start by thanking all of you for your incredible efforts. It gives, I think, the community great comfort to know that the city is so prepared for an event like this. Just one question, and that has to do with the financial hardship that we are anticipating many residents will face as, perhaps they are working, or they have extra costs because of their children or what have you, and it seems to be running right up against our tax due dates. And I'm wondering if there has been any consideration, or if there could be consideration given to moving that initial tax due date to take some of the financial burden off families in our city.
Yeah, hi, Councillor. It's good to hear from you. I did have a discussion with Minister McKenna earlier today. I know the Finance Minister was having a press conference at the same time as we were with respect to some potential financial assistance for individuals and small businesses. And the Minister indicated to me that she would be willing, obviously, to go to bat to see if we could offer some national programs. At this point, we haven't discussed the tax issue. Obviously, we need the taxes to provide all of the emergency services that we're going to provide, so that hasn't been an option at this point, but we'll certainly take it under advisement. We've had in the past, for people affected by the flood areas, had some deferrals, but this is obviously, is across the city, so it would have a significant impact on city finances, but we'll ask the city manager.
Or even if we could just do it on an as-request basis. If some people felt that they weren't able to pay their taxes at the due date, if it could be deferred, it might take some of the pressure off. Anyway, just food for thought, because obviously there's some financial implications. But thank you all again, and those are all my questions.
If I may just add, Councillor, it is nice to hear your voice. I am aware that there are some conversations going on about provincial level or federal level changes to financial support for individuals who are impacted by the directions or directives of related to controlling the transmission of COVID. So I think those are very important measures. If we're asking community members to self-isolate and then there's financial hardship, a reciprocity in being able to support people through that is really what we would like to be able to provide.
Okay, thank you.
Thank you, Councillor. Councillor Tierney?
Great. Thank you very much. I'll keep my questions brief, and if the answers could be brief, it'll help everybody move along a little bit quicker. I do want to thank you. First of all, I have a 50-plus club that's in one of our city facilities. When you say, that's it, we're closing the doors to April 5th, define immediate and how you're going to inform all these groups that are tenants of our facilities.
The Parks and Recreation and Culture group, Dan Chenier, is going to be contacting. First of all, we have 2,000 registrants in our March break programming, 2,000 families that have to be notified. That's happening and has commenced as we speak. And anybody that's in our facility on a tenant basis or clubs, associations, all those rentals are all going to be contacted individually before Monday to ensure that they're aware, and we're going to be using all of our social media and other communications tools.
So quick follow-up, when you say over the weekend they'll find out, does that mean they'll still be open on the weekend and the doors are locked on Monday morning?
Yes, the plan is that this would be effective Monday morning, and then because we need a couple days to advise people.
Great. The date, April 5th, where does that come from? Is it just time based on how we've decided to do the other things? I'm sure there's a formula behind how we got there.
So in Ontario, the March break for the schools is the next week, and then that allows for 2 weeks, a 14-day incubation period to be completed after we anticipate there'll be more people returning from affected areas.
Right, and of course, like you've always done, Doctor, you've done a great job at keeping us up to date. I assume if there's changes or if you feel it has to go longer, you'll come back to us and say, we're doing it for another 2 weeks, 4 weeks?
I have a feeling we'll be talking multiple times before April 5th.
I have that feeling too. Big question in everyone's mind, are we going to have a by-election?
Yeah, as you know, we have to go to council to decide that. That's one of the time-sensitive issues because the people in that ward don't have a representative. So that will be part of the discussion the clerk will have through a memo sometime today or Monday.
I saw Rick perk up back there, so a good question. I'm sure that will be in there somewhere. And last but not least, I'll keep it to the minimum questions. Alberta and Quebec have come out pretty strong on their position about maximum 250 group maximums. I saw the province came out today, and I'm trying to determine if it was a suggestion or a hard cap at 250, and how would that be enforced. And it's something that we're looking at, because you look at a platform at Blair Station, you'll have over 250 people. Where does this all go, and how do we have to deal with the entire situation?
This is a recommendation, in the words of the Chief Medical Officer of Health. He's recommending the immediate suspension of all large events and public gatherings of over 250 people. There's no enforcement mechanism unless I'm seeing that people's actions are directly causing the spread of an infection in the community. I may need to take some more directive action. But what we're talking about, you mentioned transit, is that there are ways to spread out some of the burden or collection of people in public places for reasons like that. And by staggering hours, we anticipate some natural decline in the number of people that are gathering. People are self-isolating without, cause, but to take extra precautions. And I don't mean to diminish that. That is fine. If people feel that the best way to protect themselves is to stay home, then that's reasonable, especially if you are an older adult and underlying chronic conditions. We just need some balance around, it is safe in our community. There are essential services. There are things people need to access. Again, just going back to the mechanism of transmission is droplets and contact, and so keeping within 1 to 2 meters away from ill people will help. Making sure you, if you're on transit or in a different place where you think you can't avoid a bit of a crowd, then keep in mind that you want to wash your hands before you touch your eyes, nose, and mouth. These things are all actually part of strengthening our community's ability to slow down transmission of the virus.
Great. Tremendous thank you. You've kept us up to date 24/7. We all appreciate it. Thank you.
Thank you. Conseiller Fleury.
C'est un petit peu bizarre de toucher un microphone un après l'autre, donc je vais venir un petit peu plus loin parmi les règles qui sont présentées. Want to, first of all, as Alice said, thank you, but I also want to thank our campuses. I think Carleton and New Ottawa are communicating very appropriately with students and with staff members, and that's, I believe, very helpful in all of this. I have questions. So as we head into St. Patrick's Day weekend, we as a city have closed or stopped the parade, which is, I believe, a very good step. But people are asking, well, what happens with the celebrations and our businesses? What do we recommend at this point for business operators and for those who want to partake in St. Patrick's?
Sure, it's the same concept that we want to try to minimize gatherings that are larger, and it may be that there are business venues that are holding people larger than 250. There's a risk assessment tool for operators to think about what they can do to decrease the risk of transmission in those settings. And it may be that businesses want to use less of their space, or different ways they can look at minimizing the number of people. Again, there's a tool. We can help people work through that and problem solve. But also from a business point of view, I think city managers looking at some ideas too.
The mayor announced that he's meeting with the BIAs and the Board of Trade and others on Monday to discuss how we can help support them. That's been a discussion we've been having. The other part of it is it wasn't the city, the council just canceled the parade, just to be clear. It was they canceled the parade. A lot of organizers are making their own decisions about. And we had this discussion. They're making their own decisions based on anticipated turnout and their own sense of responsibility to diminish the impact of this. And so I think what you're going to see and what we're projecting is that people are also going to be making their own decisions about attending large gatherings as this new information comes out about more than 250 people is recommended not to hold it. So I think we're going to start to see, our projection is some diminishment of attendance at large events just naturally across the city, and some of that will help with what Dr. Etches is talking about.
J'ai oublié au début, je voulais souligner la présence de Stéphane Giguère, président de logement communautaire, puis Vera et Tony, j'aimerais vous remercier de votre collaboration avec l'équipe Logement communautaire, qui est le plus gros propriétaire en ville, puis évidemment vos avis sont très utiles. One more question here in terms of childcare. I got your point, and as a young parent, I'm wondering, and you're a parent as well, if there were to be a parent that was affected, what would be the expected environment in childcare? As you know, kids touch everything, they put everything in their mouth. So what is your sense of, we're keeping them open under advice currently, but what if one case was to come out and they had their child in one of the child care centers in Ottawa, how would you react, or what would you say?
Yeah, I can walk you through our usual approach. So if a parent is positive for coronavirus, then we would look at all of the household contacts as close contacts. We would ask all of those folks, so including children, to self-isolate for 14 days. If those children do not have symptoms, then the guidance we have is that they are not a risk to others. And if they do have symptoms and they've been in a childcare setting, you're right. We have no way to think that that child was able to control their respiratory symptoms or wash their hands. And so we would look at a childcare facility if somebody was symptomatic in that setting as all of those folks being close contacts. And we would follow up with those close contacts and take the same approach Do they have symptoms? They need to self-isolate for the 14 days. If they develop symptoms, they need to be tested. So that's our general approach to a situation like that.
Okay. And my last question is, we're taking drastic measures. I think we have to, and I think we're doing what's important to do. But I'm worried that some parents might take the break and still fly, but then that sort of bumps up the situation when they come back. They're back on isolation for 14 days, or if they come back into our environment, then we're back to where we are today. So I wonder, what message are we sharing with parents as we head into March break, especially those who have planned trips?
I think what you see the language our Chief Medical Officer of Health using is unprecedented. I have never heard this from a Chief Medical Officer of Health. I am strongly advising the people of Ontario to avoid all non-essential travel outside of Canada. So I think that's a message I gather our Prime Minister is also conveying. It is one that I hope people are listening to and thinking about their decision making about travel in that context.
Merci. Councillor King.
Thank you. I'd really like to thank both city staff and public health for the hard work that they're undertaking during this crisis. It's really important work. I'll be very brief. I have two questions. So one is really just reiterating whether we have specific guidance and protocols for our health and community centers in the way that they do interact with clients.
So community health centers, again, critical infrastructure in our community, are healthcare settings that need to follow the same kinds of guidelines for infection prevention and control as a doctor's office. Those guidelines have been in place for a long time, but they have added, screening and other measures. So those facilities need to continue to provide health care, and we're working with them if they run into challenges.
And then the other question revolves around the supply chain challenges, and you've alluded to that, and it's great that there is a task force there. I'm just wondering if public health or if any of our agencies, public agencies, will be helping private healthcare facilities or seniors' homes with facilitation to access to medical supplies. Because I'm hearing that there's some challenges around accessing those medical supplies because they're trying to get those supplies just in the open market like everybody else.
That's an interesting question. I haven't heard it discussed yet, the private healthcare providers. We do know that the province is asking any public healthcare providers to flag issues with access to personal protective equipment or other supplies. And we know the province is actively working on increasing access, actually drawing on even federal government procurement practices, especially around swabs and masks. So I can take that back as a question in terms of if there's help for private healthcare providers.
I would appreciate that. Thanks.
Thank you. Councillor McKinney. Councillor Leeper. Councillor Brockington.
Thank you and good afternoon. Thank you for the opportunity to ask some questions. If someone calls me, a family member says, I'm sick, I need to go get tested, I don't have gloves, I don't have a mask, where are those able for people to pick up? Should we not be using community centers and libraries over the next 2 days to make supplies available on a limited basis so that when the time comes where a number of people have to start looking after a number of people, they have supplies? I have no personal protective equipment right now. How can we get that to the average citizen? Can you just note that? The value of having our city facilities open is that there are central neighborhood locations for people to pick up those supplies if they need it. But if there's anything that can be shared over the weekend, that would be appreciated. costs associated with this entire campaign. I didn't see the details with the federal announcement and whether dollars are trickling down to municipalities. Similar to floods, I believe we listed or enumerated costs. Are we doing that in this regard? And is there any real expectation that the City of Ottawa is going to get costs refunded when this is over?
Well, we are tracking the costs. The first obvious costs are the impact that we're going to have from revenue losses from closing our recreation facilities. We have programs booked. We have ongoing attendance, and that is being calculated, and we're going to capture all of our costs. The challenge we've had in the past is that the federal and provincial governments have not recognized the cost because we haven't passed the threshold because we're such a large municipality of the amount of money that they would normally fund, which is intended for the smaller municipalities. So unless we're getting into significant costs, the portion of our budget, it's unlikely we're going to get any funding. But I'm not saying we're not, because it's a situation, as Dr. Etches said, and the mayor has referenced his discussion with Mr. McKenna, as the situation evolves, I think both levels of government will be looking at the assistance that municipalities, if it goes for a long period of time, are going to require. So we're going to continue to hold the hope that we're going to get support, because if this goes on long, it will be a significant impact to our bottom line.
Sure. And can you confirm that regardless of the severity that Ottawa gets hit, that public transit will still operate, even on a limited basis, but we will continue to provide a means for people to get throughout the city?
Yes, we've discussed that. We have not discussed closing or reducing public transit. The big factor, and it's going to be a factor for all of our essential services, is our ability to reduce absenteeism and keep our workforce in place. So if our bus operators, our mechanics, all the people in the chain that, as you know, being on the Transit Commission, are impacted, and we start losing 20% of our workforce, there could be impacts to the service across the board, not only for transit. But our intention is to continue operating. We're giving specific guidelines to our transit staff in terms of if they're sick, please don't come to work, call your supervisor, etc., as Dr. Etches articulated.
My final question is on that note, business continuity, as you mentioned at the beginning. I'm not sure what the stats say in the hardest hit cities around the world, Wuhan and other cities, but the people who have very specialized technical skills to run a city, people who run the water filtration plant, paramedics. I don't know what the stats are, how many paramedics in Wuhan were taken out because they got infected and had to step out from their duties. But again, how will we manage to provide those emergency services if we have X percentage of our firefighters or police or paramedics unable to provide that service?
I'll start, and Tony can, being a former general manager of emergency service, I can answer that part of the question, I suppose, is that it's like, police, fire, and paramedics, they start pulling in towards core services as we progress. So what ends up happening is the nice to have paid duties, the things that we would do as extras, we'll start pulling in and focusing on core service response to protect our employees. And we're taking extraordinary precautions with personal protective equipment and the types of calls and protocols they're implementing as a team. They have a task team, and Tony can talk about that in terms of the protocols for when they know they're going to a call that could possibly subject them to danger. Tony, do you want to add something?
Yeah, just so Mr. Kanellakis is right on. So that's exactly what the team's currently doing, looking at the category of calls. What can we shed right now? How can we protect? These groups, at least the emergency services, personal protective gear is something that they deal with every day. So that's already been in place. So we're hoping that they don't get, even though they're exposed more than the average population, they're not more affected than the average population. I mean, Dr. Etches can tell you of what they've seen elsewhere, 30 to 70% of people can be affected. So we're putting those protocols in place. And as we said earlier, those 3 buckets, we have to provide those services. We're already looking at protecting that. these two major operations, COVID-19, maybe our flooding, how do you respond to that, and then how do we do that if we lose maybe 10 or 20% of our staff? So we're already on that, and we're trying to stay ahead of the curve. And as Mr. Kanellakis indicated, everything we're doing preventative, we're really posturing forward in our operations to be ahead of the curve on everything, to try to stay ahead of it. That's our main objective here.
Good. Thanks very much.
Thank you, Councillor. Councillor Ménard? Conseiller Cloutier? Councillor Derouz? Councillor Moffat?
I just want to thank... Hello?
Councillor Derouz?
Hello? Yes. I just want to thank everyone for the hard work they've been doing. We're very happy with the information we're getting. I just want to remind Mr. DeMonte and the city manager that whenever you have some development in rural area, I'm hoping that you keep in mind that the distance, and we have lots of community with senior and with long-term facility that we need to be able to communicate to them and be able to bring for them some more information. So hopefully to keep this in mind.
Thank you. Councillor Moffat? Councillor Meehan? Councillor Hubley?
Hello. Thank you very much for the work done on this. I think. Hello.
Hello. You can go ask your question.
Sorry, I just heard the sound. I thought I lost the call. No, I just want to say thank you. I don't have any questions. I think they've been all answered already. So I guess that's one of the advantages of going 23rd. So thank you very much for today.
Thank you, Councillor. So we will now take questions from media. Nous allons maintenant prendre les questions des journalistes. We will start with media in the room. On va commencer par les journalistes qui sont ici avec nous, and we will allow one question and one follow-up question per media outlet right now.
Hi, I'm wondering, as we close facilities, starting on Monday, I'm thinking about the workers who work hourly wages, I guess. Are we doing anything to help those employees, say, who teach swimming lessons, et cetera, who count on a salary?
Well, there's two categories of employees that work in the recreation centers. We have a full-time staff will still be there because the big plexes and the arenas, we still have to maintain the ice, we still have to chlorinate, maintain the pools, we still have to keep the buildings clean and HVAC and all that stuff. So those employees will still be attending. The casual temporary employees are the ones that'll be impacted on a short term. Some of them may be able to come in because they're doing scheduling and preparation and helping us with notification and all the other things. But there will be employees who are on a temporary nature, casual nature, who will not be working during that period.
Is City Hall going to be closed starting Monday?
No, City Hall will be open. The only thing that we'll be looking at, any large bookings, over 250 people that are booked for City Hall, we'll be notifying that we'll be canceling those, but the client service centers and all the city services in our client service centers and facilities will be open.
Okay, thanks. Dr. Etches, you were great. Yesterday I spoke with you about the second case of coronavirus, when that person landed, where they've been. Can you tell us about the third case, when she landed in Ottawa, where she's been, who she's contacted with, who you've had to contact? I've already heard a lot of concerns in the community about places she's been. I don't want to be reporting rumors. So can you tell us a little bit about when she arrived back in Ottawa, where she's been, and your protocol as to contacting all the places and people?
Regarding the third case, I actually don't have all of the details about exactly when she arrived. The team's been very busy handling that. I've been busy doing other things. So what I do know is it's a large number of contacts that need follow-up, and so we always start with the household contacts first, and those who are at closest proximity and at higher risk of transmission. When we're looking at a case, if there are a larger number of contacts, then we work out from there those who would be medium risk or who may have had transient contact with someone. Transient contact is not a risk, for transmission of the coronavirus, but that's the process we work through, is to start with the highest risk and work from there.
And sorry to follow up on that. I mean, one of the 12 people who was tested today is someone who was in contact with her at a local business. People from that local business are worried. People have been to that local business there. And so how do you follow through there? And I don't know if you want to take this online. If you don't have those details, maybe someone else at Public Health does.
So if there are people who are identified as close contacts to a case, then what happens if they have symptoms? We talk to each of them. We end up with that one-on-one nurse interaction to determine whether they have symptoms. If they have symptoms, then we do want to confirm that that's the infection, and we recommend they're tested. If they're positive, we work out from there, and we look at that person's close contacts, and we keep going. Yeah, this is early days that we're trying to do that containment, to draw circles around the case and keep drawing circles. That process could change in the future, depending, but that's our effort right now. We're really focused on trying to limit the ongoing transmission.
Just quickly, you said it's a higher number. Do you have any sense of how many contacts you're needing to get in touch with?
No, sorry.
I'll talk to you later.
Thank you.
Fred Sherwin from the Orleans Star. Dr. Etches, given the fact that seniors are highly susceptible to COVID-19, they have a much higher death rate than the rest of the population, and also the fact that people can carry the virus and not show any symptoms, why would you not order senior care residences to ban visitors? And is that your call, or is that the Ontario Public Health call?
I think, as you've mentioned, seniors are a top concern in terms of having more severe illness, and you can see in some of the provincial government directions so far around long-term care homes that what their approach has been is to screen each visitor.
But screening visitors, if you're carrying the virus and not showing symptoms, you're going to fall through the cracks of that screen.
I know there is a lot of concern about asymptomatic transmission. I hear it every day. I get a lot of advice about asymptomatic transmission. It's not a major contributor to any large number of cases that we see developing. It's possible. It's something people have described, but the virus. It grows in numbers in your body, and it's harder to transmit when you don't have as much virus. When you have larger numbers of virus particles in your body, that's when you develop the symptoms, and you're more likely to cough and sneeze, or have more danger of transmitting the infection. Absolutely, our advice is, if you can limit your visits, don't visit when you're sick. Don't visit a retirement home. Don't visit a long-term care home. Don't visit your family members who are older adults if you are sick. At the same time, to completely shut down all visitors to older adults would have a really negative effect. And we're talking about a process here that could take many, many months in our community. And for seniors to be socially isolated for that long is also, a risk. Social isolation on its own is hazardous to the health. So we're taking an approach right now of making sure we emphasize the risk to older adults, not visiting when you're ill. And it is possible that in long-term care homes, we'll see more direction around no visitors. That time could come. Retirement homes may want to follow suit. This is something that individual operators of retirement homes could take upon themselves based on what they see in their own facility and what makes sense to take a more protective approach as well.
And a quick sort of follow-up. For an ordinary healthy person, if I'm not afraid of catching the flu, why should I be afraid of catching COVID-19 in terms of my own physical being?
Yeah, that's a good question. I think most people will make it through this illness very well. It's a community problem. And so every person who becomes infected, you might make it through well, but you might pass it on to someone else. And so it's not unlike in the flu season when we recommend people are vaccinated. It's to protect yourself, but it's also to protect the more vulnerable in our community. So this massive undertaking, this unprecedented action, is not because we think most people are going to have severe outcomes. It's because some people will have severe outcomes, and we have an opportunity to limit that.
Well, I'm asking on the fact that to try and lessen the panic type of thing when people are saying, there are people out there who think that this is much more serious than the flu virus in terms of physical ailments that suffer beyond the transmission process.
I think that's a fair comment. I would like to let the public know that most people will make it through this illness with self-care at home. Most people don't need to visit an assessment center or a hospital, and that is encouraging. Yeah.
Oui?
Prochaine question.
Oui, on a déjà dit que les centres de services restent ouverts. Il y a des installations qui sont fermées, par contre. C'est possible de nous dire en français qu'est-ce qui va être fermé essentiellement dans les prochains jours? Puis qu'est-ce qui va être ouvert?
Donc, toutes les fonctions où ce qu'on a des activités où il va y avoir 250 personnes ou plus vont être fermées. C'est-à-dire, dans l'Est, on a le centre à Orléans, Shankman, le théâtre Shankman sera fermé, ce genre d'activité-là sera fermé, donc afin de diminuer la capacité à cet égard-là. Par rapport au centre de service, le centre de service ici à l'Hôtel de Ville, où ce que les gens se présenter pour avoir des services, ça va être ouvert encore, il n'y aura pas de problème. Mais toute activité où il y aura des grands rassemblements, tout édifice de ce type-là va être fermé, ainsi que tous les centres de récréation, donc les piscines, les arénas, etc., parce que ces activités-là apporteraient des populations plus élevées.
Puis, concernant les comités, commissions, conseils municipaux, on va limiter ça aux items essentiels. Est-ce qu'il y a des mesures qui sont prévues pour, par exemple, une réunion de comité qui attire quand même un nombre important de personnes et de délégations publiques? Est-ce qu'il y a quelque chose qui est prévu dans ce contexte-là? Est-ce que les gens sont invités quand même à venir?
Oui, mais comme j'ai dit, pour les consultations publiques, on décide chaque cas parce qu'il y a une nécessité, par exemple, d'offrir une session de consultation publique. Si ça ce n'est pas nécessaire, on va faire ça dans l'avenir. Et au sujet de la réunion et des réunions du conseil, des réunions du comité, le greffier va donner des suggestions probablement demain ou lundi pour son conseil, parce que pour le moment, la priorité est d'avoir des réunions courtes avec pas beaucoup de personnes dans la salle, parce que c'est nécessaire de protéger toutes les personnes qui visitent l'hôtel de ville.
OK. Donc, une réunion du conseil, par exemple, qui aurait lieu, le public serait invité quand même à venir assister.
Parce que la prochaine réunion, je pense que c'est le 25 mars. Là, on avait le temps de décider qu'est-ce qu'on va faire avec ça, mais on avait seulement la semaine prochaine de comité de police et de transportation en commune. Et on va décider, je pense que c'est nécessaire pour nous autres de parler avec le président Sandy Smallwood de la conseil d'administration de la police, parce que nous n'avons pas le droit d'annuler ça. Et au sujet de transport en commune, on va parler avec le président de ce comité, M. Hubley, et décider est-ce que c'est nécessaire d'avoir cette réunion ou est-ce que c'est possible d'annuler pour le moment. Yeah, so, the clerk is going to look at the committee agenda over the course of the next couple of weeks. We know next week there are just two committees, Police Services Board and Transit Commission, and the Police Board will have to decide themselves. We can't direct them, and we'll engage in consultation with Chair Hubley if there's anything on the agenda that is not essential. Either cancel the meeting and bring any essential items directly to Council, which we have the authority to do at the 25th.
Just as a follow-up, Mr. Mayor, I've actually been in contact with Chair Hubley throughout the meeting, and he's still on the line. And we're preparing a cancellation notice for his Transit Commission meeting and the matters, particularly the collective bargaining negotiations. I'm recommending go straight to Council on March 25th, but we'll be producing that later on this afternoon.
Okay, I think that's the ATU position, correct? There's a timeliness in that. Yeah, okay.
Nous allons maintenant répondre aux questions des journalistes qui sont au téléphone. We will now take questions from media on the phone. No, it's one per outlet, sorry. Just to... So, is there anyone from Global News on the phone? No. 1310 News?
Je peux demander en français aussi. Pour Radio-Canada.
CFRA? Rogers? Ottawa Community Voice? And Element FM. So, Matthew.
Thank you. There was some mention of staggering LRT commute times or staggering public transit commute times. Just apart from people changing their own behavior? What measures is the city taking to protect transit users?
Well, the first measure is what Dr. Etches has discussed in several of the answers to the questions, is that people self-regulating, and if they're not feeling well, not to take transit and stay away from transit. I mean, that's probably our best defense to that. We are following through OC Transport. Mr. Manconi is in constant communication with Ottawa Public Health in terms of changing protocols, the rules, and cleanliness. I know there's been some discussion about what other transit areas have done with respect to cleanliness. We believe we are following the protocols that are being recommended by Public Health. We're looking at that again, whether we can step that up and do more. We're particularly focusing on paratransport and those vehicles because of the nature of the clientele who may have other underlying symptoms, as Dr. Etches said, to ensure that we can sanitize those vehicles much more frequently. It's much more difficult to do it with buses where they're stopping every couple minutes and different people are coming on, and with trains where you clean it, next thing you know, another 100 people are on the train, and you can't keep the cleaning protocol that quickly. It's a false sense of security, quite frankly. We're hoping that the federal government, we've been in contact with the Government Operations Center, and they have left it to the deputy ministers for every department to make a decision on direction to their staff, operationally feasible, who should work from home. I think we'll start hearing more from the federal government about that, and I think you're going to see, and that's why I said earlier, a lot fewer people, a lot less people coming downtown to the core, to the federal government buildings, and being encouraged to work from home. And I'm hoping that the rest, including our own employees, are making arrangements with their managers to stagger their start and end times to spread the load across the system.
Et est-ce qu'on pourrait avoir cette réponse en français aussi?
Si vous voulez, je vais le prendre en français. Donc, en ce qui concerne le transport en commun, notre objectif et notre pensée, c'est que, d'une part, au niveau de l'employeur le plus gros, le gouvernement fédéral, ils ont laissé la décision aux directeurs généraux de tous les départements. Fait qu'on pense qu'on va voir dans les prochains jours une analyse à cet égard-là. On va voir une diminution au niveau du transport en commun. Par rapport à la ville, le directeur municipal a indiqué pour notre personnel, ceux qui peuvent travailler à la maison, donc les ajustements vont se faire dans les prochains jours également. Et le reste de la population et le reste des employeurs vont probablement également s'engager. Donc, notre première pensée, c'est que ça va se régulariser d'eux-mêmes. On va avoir une diminution au niveau du transport en commun. Et comme le Dr Etches a indiqué, ce qui est le plus important, c'est que chaque individu doit eux-mêmes porter attention et prendre de la direction et les recommandations du docteur en ce qui concerne la protection de la population en général et notre responsabilité commune à la communauté au complet pour se protéger et ne pas partager cette maladie, si vous voulez.
There's a little bit of hot potato on daycares, because it sounds like the province to some extent is recommending daycares check with local public health authorities, and some of the answers we were talking about today said you were consulting with the province on how to handle daycares. Maybe I'm misunderstanding, so please help clarify, but I guess what kind of input are you giving daycare operators about their operations or whether they should be remaining open? I guess what is the Ottawa Public Health side of it?
Okay, I think we're following the provincial direction. I don't think there's a conflict between the two in terms of the provincial direction is to actively screen children, parents, visitors, staff, and in both public daycare settings as well as private. So that's what we're working on, getting that message out easier through the city facilities, but we also have a network with private daycare providers at Ottawa Public Health. We have ways to reach out to all of them to let them know that this is the practice that will help protect their clients.
And is there anything about...
That last question, please.
Okay. Is there anything that... in terms of medical clinics, how they should be handling their operations, if they should shut down, there have been some medical clinics that have at least suspended operations so they could have cleaning after someone who may have been in touch with a COVID-19 positive case came in. I guess what direction are you giving to medical facilities and how to handle it? And I'm going to say now, dans les deux langues, s'il vous plaît.
Okay. So first in English, we need our healthcare providers to provide healthcare, and so the way they can protect themselves is through typical infection prevention and control measures for respiratory illnesses, like influenza, and that those measures are typically in place. If someone comes in with a fever and respiratory illness, they're usually asked to wear a mask, to be isolated in the waiting room, or brought right in to an exam room, and to use hand sanitizer. The evidence, the summary that was released again today, confirming that this is spread by droplet and contact precautions, should allow us to avoid the situation where a healthcare provider thinks they need to close their whole office after somebody's come in, and as long as they've taken these precautions of isolating someone and using a face shield, gloves, gown, and mask. Alors, c'est important pour notre médecin d'avoir accessibilité et que leurs cliniques sont ouvertes, et c'est normal pour les cliniques de prendre les précautions pour éviter la transmission d'une maladie respiratoire. Alors, c'est possible de donner soin aux gens avec une maladie, mais on prend les précautions d'isoler le patient, d'utiliser un masque et l'autre chose pour protection.
Thank you.
Can I ask two very quick points of clarification? I'll take Lowell's time. This is very quick. Mr. O'Connell, am I to assume that the March 25th meeting will go ahead as scheduled, unless further notice? The city council meeting,
Mr. Mayor?
At this point, yes, and if there's a change, we'll let you know. But but our desire is to try to minimize non-essential items that are not time sensitive.
Why wouldn't we have put off? I mean, I know you have to decide them, but when should we have it if we're not gathering and having meetings?
Yeah, that's always the difficult call, because we don't know how long this is going to last, and obviously we want to make sure that the residents of the area, especially during this difficult time, have some capacity to communicate their concerns with the rest of the city. So it's a difficult situation, and we'll have to use our best advice as we head closer to that decision day.
So thank you very much.
Merci.
Thank you, everyone. Thank you. We're not taking questions anymore.
I would say there's a good chance that there's going to continue to be interest in taking public health measures that protect the public. Social isolation is one of those measures that could continue.
So hopefully if the world hasn't ended by next Friday, we're actually people speaking.
Can I just have a quick private?
Due to the length of the preceding program, we now join the regularly scheduled program already in progress.
Hunchback that lives in the bell tower.
So you guys have been working on this for a long time. What has been the most rewarding part?
The most rewarding part, honestly, is to work with my friends because they're all so supportive and it's a really great environment to be in.